You can't manage that, Sterling.
In a press conference yesterday, Prime Minister, the Most Honorable Andrew Holness, strongly encouraged the wearing of masks in public places as part of efforts to contain the spread, flatten the curve of COVID-19. This morning, we have some medical doctors that are going to be sharing their opinions on the use of masks and some options. And we're starting with the Ministry of Health's recommendations. To take us through that is Dr. Simone Spence. She's Director of Health Promotion and Protection at the Ministry of Health and Wellness. Good afternoon. Well, good morning. Morning, Dr.
Morning, ladies.
Spence. How are you?
I am good, thank you.
It's about Jamaica time. It's already afternoon. All right, so tell us, Dr. Spence, what is the ministry recommending in terms of the wearing of masks?
So the Ministry of Health and Wellness is recommending the use of masks by specific groups of persons. So persons who are ill with respiratory symptoms, that is persons who are coughing and sneezing, persons who are quarantined or isolated at home, especially if they're having respiratory symptoms, in order to protect their other household members or persons who they're caring for within that household. We're also recommending that persons, elderly persons and persons with chronic illnesses also wear masks when they're at home, especially if it is that they are not alone and so therefore would be exposed to other persons who are coming in and out of the household.
We want to talk about the benefits of wearing them because we hear some people say it's a false sense of security and so on. But why not just have everybody do it, Doc? Why not just say wholesale that, as in some countries we see, where other people just wear it as a matter of course? Why not just say we think everybody should do this?
Well, the use of masks alone is really insufficient to provide an adequate level of protection alone. And so one of the things why persons indicate that it gives a false sense of security is that persons then forget about the other measures that they need to be taking. So the infection prevention control measures, which include the appropriate hand hygiene, the physical distancing, which is so important, making sure that you're at least 1 meter to 3 feet away. So yes, in specific situations, the wearing of masks do help, or does help, I should say. But it shouldn't be where it is being worn and then persons believe that, okay, because I have on a mask, I am protected, and therefore neglect the other aspects of the prevention measures that are also critically important.
I want to break down when we say respiratory illnesses and chronic illnesses, exactly what those are, Doc. Let's start with chronic. When we say chronic illnesses, what are we talking about?
So when we refer to chronic illnesses, it means persons who have conditions that are not curable. So it's not acute. It's not temporary. So, for example, persons who have diabetes or sugar, high blood pressure, hypertension, heart disease, persons who have, for example, asthma or what we call chronic obstructive pulmonary disease, which is a chronic lung condition, persons who have sickle cell disease. So anything that the person once diagnosed will have it for their lifetime.
Would lupus fall into that category as well?
Yes, lupus does fall into that category of chronic illnesses.
What about people who may not have those illnesses, but for example, who may be smokers, whose lung functions may be compromised? Should they be wearing masks?
Well, those persons, because they would have, through the activity of smoking, damage the lung tissue, it is quite possible that they will be more vulnerable. And therefore, wearing masks may be of benefit to them. But I want to re-emphasize the fact that the over-reliance on masks can actually put persons at greater risk because persons are not necessarily wearing the mask appropriately. I've seen many instances where the masks are worn under the chin because it's so uncomfortable. It's not something that persons are used to wearing routinely. And so literally after about 5 to 10 minutes, you're sweating, you start fiddling with the mask, and there comes now the risk of exposure because they're near your eyes, your nose, and your mouth. So if your hands have been contaminated, you then just would have introduced the virus for getting into the system. And then we forget that because we have on the mask, we forget to wash our hands or to hand sanitize as frequently. Once the mask is soiled, you're not supposed to be touching the front of the mask. The persons are not even removing the mask appropriately either. And again, hands become contaminated and the risk of infection therefore increases.
Don't move from that point from me, Dr. Spence. Removing it should be from the side of the mask?
So depending on the type of mask that you have, you know, there are some that come with the loop across or behind the ear. And so you have to remove it that way, not from the front of the mask, touching the front of the mask.
Or tie from the back, pull from the back.
Right. So then use the strings at the back and pull those and remove it using the string.
So let me ask you, Doc, because a lot of folks are now shopping for masks. What kind of masks ought we to be wearing? I've seen people walking on the streets in the surgical mask. I don't know if you're looking at the screen. Uni, can you put them back up again? I've seen people wearing the one in the middle, on the top. I have bought some dust masks. I don't know if those make sense. A lot of people now are making cloth masks. How do we know what we're supposed to wear and what is really most effective? We know the N95s are for the healthcare workers, but what about the others? What should we be buying? And then how often should we be wearing the same mask, if at all?
Right. So first and foremost, disposable masks are the ones that are preferable because as soon as it is soiled, you're supposed to remove and discard. The N95, the surgical mask, the FFP1 mask are for healthcare professionals and should be reserved for those persons because as we would be aware, there is a global shortage of masks and the appropriate type of mask. And so we don't want persons removing that stock from the healthcare professionals, both in private and public settings, from being able to access these types of masks. Because as you would recognize, healthcare workers are at greater risk of exposure based on the type of functions that they are carrying out routinely. Now, the other types of masks that you have listed there, the cloth and the sponge mask, as Prime Minister had indicated yesterday, some sort of barrier is better than nothing at all. But with these masks as well, you're recognizing that in terms of, even though it's a barrier method, it's not foolproof. And because they're reusable, as soon as they're soiled, you have to wash it, dry it properly, and then put it back on. So, you know, we want to make sure that we reserve the medical mask for healthcare workers. And if it is you have to go out in public, then you use some sort of barrier covering. But I think the most important message here is that if you don't need to be out on the road in a crowded situation, please stay at home.
We're underlying that.
Stay at home for us as healthcare workers so that we are able to stay healthy as well to be able to take care of you.
Yes, Dr. Spence, we thank you so much for that and what you and your colleagues are doing for us. Dr. Simone Spence, Director of Health Promotion and Protection at the Ministry of Health. All the best to you, Doc. Thank you for joining us this morning.
Thank you for having me.
Yes, so joining us via Skype and phone calls this morning. Let's see if we can sort this through. Former Chief Medical Officer Dr. Winston Delahaye and Dr. Michael Abrams, OBGYN, who has also been, I think, promoting the hashtags Masks for All. Good morning to you both. Thank you for being here.
Good morning, gentlemen.
Morning, Simone.
Hi.
Hi, Simone.
Good
Thanks for
morning.
having me.
Dr.
Yeah, hi.
Delahaye, let me start with you. I was reading in this article. You've been calling for this for a long time. And I think you would have wished this discussion or this decision would have been made sooner. Am I right? You're happy now that we are there, or do you think there's more that can be done in terms of really drumming this home to the
You're not
members of the
happy.
public?
You're not happy, Simone.
You're
Harsh
not,
reality.
you're
When
not
you're at the
happy.
bottom of the class, when you're at the bottom of the class, you don't complain that there's too much homework. The ministry's response has been wishy-washy, to explain in Jamaican terms. Very clear and easy.
Tell me, I want you to expound on that
Seems to be a problem with that.
with this feed.
Dr. Abrams, are you with us?
Yes, I am.
All right, so you've been saying masks for all. So I don't know if you want to pick up on the question Simone was asking in terms of my challenge with masks for all is that then it becomes a mass exercise, and then people start making masks out of anything.
I think that's already, I think we
But
have to be
that's what we
careful.
need.
To make it out of
That's
anything.
what works. A mask out of a piece of brief, I'm good with it. A mask from paper, if you have sufficient paper each time, that's fine. What we're saying is, my mask protects you, your mask protects me. We need to make it law, as it is in the Czech Republic, for example, and Austria, and neighboring Slovakia, because it makes sense. Again, if you're at the bottom of the class, as it relates to testing, for example, we're third up in the Caribbean after Haiti and Guyana, woefully inadequate. You need anything that will work to protect your people and save lives.
Before I go to testing, Doc, I want to say, what the researchers said, though, that some of the cloth masks don't protect anything, that the particles would still be able to come through the mask. Some of them, I think, are not breathable.
Are not
So-
fitted
and are
properly,
not,
depending on how they're made.
So should
What you
we,
need to use the PR money to educate persons about. And it's very easy. If I am infected, and it's likely I don't know, because persons who are positive may have no symptoms, then I can help you by protecting my nostrils.
Okay, feed is going in and out, Doc, but we're going to come back to you when we get you up and running again, which I'm sure we will. Mike, are you there?
Yes, I'm here.
All right, Mike, let me get your take on this because you two have
Right.
been, as we said, promoting the hashtag. Go ahead.
No, go ahead. What's the question?
We're asking how you feel about the government's response now. Are you happy now because you've been advocating for masks for a while?
Yes, I have. I think our government has been proactive. When you look at a lot of other countries, they've been the ones that have been reactive. For example, England, America. You know what's happening over there.
Yes.
Italy. I think we've been proactive. The only issue I have right now is that I think they should tell everybody to wear a mask.
Right, and
I
tell us
think
why.
I think the potential benefits outweigh the risks. And if you look at it logically, they're recommending that if you are COVID-19 positive, you wear a mask. Am I correct?
Yes.
well,
reason for
So
that
that
is
you-
they've expanded that to also include people with chronic illnesses
Right.
and respiratory illnesses, and
Underlying
persons-
conditions.
and persons over 70.
Right. So that suggests that they do believe that there is a value to wearing a mask.
Right.
No, the reason why I think everyone should is because I don't know if you're aware of this, but up to 25% of people with coronavirus have no symptoms.
Right, asymptomatic, gotcha.
And there's another thing. Not only are they asymptomatic, people can start shedding the virus from at least 2 days before they begin to show symptoms. Those who become ill, they can shed the virus from 2 days before. So if you can be asymptomatic and have the virus, and if you can actually start shedding the virus and not even know you have the virus, why not wear a mask?
Well, the
right,
guidance,
sorry.
sorry, Dales. The guidance I hear Dr. Fauci giving is that everybody ought to, and this is a doctor in the States, is that everybody ought to act as if we all have it. And
Yes.
if we are working at that with that kind of mindset, then I guess your reasoning would make sense.
It's not just about protecting yourself because it is not a perfect barrier. I mean, it will stop some stuff coming at you, some droplets. It will help to, like, if you want to touch at your face, it may be a barrier.
but it's not perfect. But some protection is better than nothing. And it's important that if masks are to be used, that people are told to continue washing their hands properly and regularly and to maintain social distancing. That's extremely important. The concern about people having a false sense of security wearing a mask is a real one, because some people may feel invincible when they wear it, or that this will just protect everything, and that's not true. And people also have to be taught how to wear the masks and take care of them. In an interview just a while ago, I heard you speaking about that.
Yes.
That's also important. So I think if everyone is told to wear one, and there's also some education in place, it will benefit all of us.
All right, Dr. Delahaye has rejoined us via phone. Dr. Delahaye, before you left us, you were talking about testing. And I wanted to expand on that because we've not been so good at testing anything. Chick-V, our testing protocols were not the best. So, I mean, in times of COVID, do we have access to what is required to expand testing? The resources we need? Are we in a situation where we are just where we are and we have to make the best of it?
Well, we're told that there's no issue with funding. The harsh reality is we're at the bottom of the list. There's Haiti, 22 per million persons, then Guyana, 146, and Jamaica struggling at 182 per million, compared with the Cayman Islands, 5,500 odd per million, St. Kitts, 2,800 per million. It's not good enough. If you're not testing, you can't know how many positives you have. Very, very clear. And the issue is well established in many countries throughout the world.
Yep.
So that's about allowing persons to have a false perception that they are not doing too badly, not mask issues. So we need clarity on those things.
I was asking, so in terms of testing, what would be required to beef up testing? In my layman's mind, there are test kits. I might be wrong. So are you saying we need to go and acquire more test kits? What is it that we're saying?
What's required is, for example, as is done in other outbreaks, not necessarily a flu-related or coronavirus-related, facilitate through the University Hospital of the West Indies, University of the West Indies, parallel testing with cheaper, more affordable, and in many instances, quicker testing kits. They know these things. They've studied them. And, of course, should we do that, the sooner we'll be able to test more persons as we need to be testing.
How would the testing process work? Because a lot of people are asymptomatic. We're saying may have it. Do we go into the communities, for example, that are hot spots? Do we say to people, if you cough, come? Do doctors recommend? How would we work that out?
So a point you just made, which is where the ministry has been wrong, and they, I imagine, have been adjusting their position, is that you test only persons who are symptomatic. The point is, many will remain asymptomatic for the lifetime of the infection. And so that's why contact tracing is done. You identify someone who presented ill, they are positive, you get everyone around them and test them. It's why you have lockdowns. You shouldn't be locking down to then ease that lockdown, not having tested everyone around that community. That's the purpose of testing, so you know what's out there, where they are, to then shut that down. That's the basis of public health. Prevention is the base to prevent others becoming infected. You can't know unless you test.
I want to ask you, Dr. Delahaye, this article says that I'm reading, it was in the Jamaica Observer on the 7th of April. I want to know if you stand by this view, because and then I guess it's a broader question of the response, how we're doing as a nation, because this says that you are saying that there was some level of resistance to the wide-scale wearing of masks because you thought it was because the recommendation was coming from the opposition PNP. Is that something that you really stand by?
Yeah, I really believe that, and it's very unfortunate. In the same way that early out I made a recommendation to set up field hospitals, not hotel rooms, for persons who may be ill and recovering but still needing attention, but field hospitals, as they've now done in the case of the arena. And so where you have persons really ready with valid recommendations, not just off the cuff, off the top of their head, you might want to have a non-partisan approach. I'm not so sure that's the situation we're facing now, so that you have persons who may have that ability, that training to make those suggestions, bring them on board for in the interest of the Jamaican people, first and foremost. It can't be with lenses of color.
My producer is going to kill us because they've told us to wrap. But I thought that a committee was established that included persons from both parties, a parliamentary committee for COVID-19. Isn't that committee still meeting?
Well, so the recommendation, for example, to include increased testing, that has been made, and for a long time now. And so the reality is, as opposed to holding firm on positions, as they have for a long while with the masks, and still with their current position, has led to confusion of Jamaicans, as opposed to saying, we're doing every man for a mask. Simple. That holding of position has continued to fuel confusion in persons' minds and not allow the country to move forward more quickly.
All right, I have one final question. I'm not sure this was. I was looking at your Twitter feed this morning. You are thanking the government for what they have done so far. You referred to the Prime Minister's remarks yesterday at the presser that he gave. You are not convinced that the enhanced curfew measures will do what we hope it will do, and you're suggesting that it needs to be shut down, locked down.
Simone, there's one way, and this is well established scientifically. If you shut down people's movement, people's interaction, you shut down the ability of a virus to move from me to you. If you don't see me in a supermarket, I can't infect you. And so that's a decision that needs to be made. It's not an easy one. That's why you have leadership. Leaders make appropriate decisions for their country.
All right, thank you so much for joining us. I want to say thanks to Dr. Simone Spence, Director of Health Promotion and Protection at the Ministry of Health, who joined us earlier, and then Dr. Winston Delahaye, former Chief Medical Officer, as well as obstetrician and gynecologist, Dr. Michael Abrahams. Still to come, the folks from Jamaica Red Cross talk with us on the importance of voluntary service during a pandemic. Smile Jamaica will be right back. Remember to
wash your hands.